Hi, in this video, we will discuss solving nipple issues during breastfeeding. Some mothers have problems like small, flat, or retracted nipple, and some mothers have large nipples, and they might cause some problems while feeding. And these mothers will be suspicious, and they may have the doubt that whether they will be able to breastfeed their newborn baby. So the objectives here is to detect flat or inverted nipple, to give corrective measures, which is not that important because these are structural problems and they do not change. And how to advise a mother regarding breastfeeding in mothers with nipple issues, which is most important. Now, nipple and breast comes in different sizes and shapes, and babies can breastfeed almost all of them. So that is the key message that you should understand, that whatever the size of the breast or the shape of the nipple, the babies will be able to breastfeed in almost all of these conditions. Even some mothers may have small breasts, some mothers may have very huge breasts. Even the glandular tissue, the amount of fatty tissue may vary, but still the baby will be able to breastfeed. So these are not issues because that is why, because the attachment is the key to successful breastfeeding. That means the baby is not sucking at the nipple. The baby is sucking at the area of nipple and the areola complex all together. So the latch has to be deep, the attachment has to be deep, and the attachment is not confined to the nipple only. The baby's mouth attaches to the entire nipple and the areola complex. Therefore, even if the nipple is small or flat or retracted, it is not a problem for the baby if it is done in the correct way. So what we have to understand is that the babies breastfeed and not nipple feed. And as long as your baby can take a good portion of your breast into their mouth, that means the baby's mouth and the gums could bypass the nipple entirely and latch onto the areola, most types of flat and inverted nipple will not cause problems with breastfeeding. Some types of nipples are more difficult for a baby to latch onto at first, but in most cases, if you pay careful attention to latching positioning, along with a little patience, we will ensure that you and your baby will get off to a good start with breastfeeding. So flat and inverted nipples, how do they look? Normally, it gets corrected when the baby suckles. Now, if the problem persists, following technique should be applied. One is the inverted syringe technique and double syringe technique. Both these techniques, I would say, will not correct the problem entirely, but there may be slight improvement. So this is a regular nipple. This is a mother with a flat nipple, and this is the mother with a inverted nipple. Now, how do you detect the flat or inverted nipple? This is basically by a pinch tester. Now, you can put your thumb and forefinger around 2 to 3 centimeters behind the nipple and pinch your fingers together and see what the nipple looks like. If the nipple stands out, then it is a normal nipple. If the nipple remains flat, then it is a flat nipple. And if the nipple is pulled inwards, then it is a inverted nipple. So the same test is repeated again, but here you can grade it. This is the grade 1 where it is an inverted nipple, and grade 2 which is inverted, but when you release the pressure, it retracts back. That's a grade 2. And grade 3 is, even if you press, it still remains inverted. That is a severe form of inverted nipple. But that is not a issue here because as you have already seen the previous slide, the baby is not nipple feeding, it is breastfeeding. So flat nipple can be identified before delivery, but it is not probably of not much help. But the major thing that you should do is to build the mother's confidence. So the breast will improve, that is should be explained to the mother, and explain that the baby sucks at the breast and not at the nipple. And let the baby explore the breast, do skin to skin contact with the mother, by placing the baby on the mother's chest and help the mother to position the baby early. Try different positions. Usually the football hold position or the cross cradle position will help in such mothers. Will help her and help her to make the nipple stand out by pressing around the areola. And if this does not work, then she can express the milk by either a pump and or hand express, and then give the baby the milk through the spoon feeding or cup feeding, and avoid using bottle feed, because in tropical countries there is more chance of infection with bottle feeding. Now, for the first week or two, express breast milk with feed and feed with the cup, and if necessary, express breast milk into the mother's baby's mouth. And after 2 weeks, most likely these babies will be able to directly feed from the mother. Then this is the Hoffman technique, which is used for inverted nipple. And here we place the thumbs at 9 and 3 position, 3 o'clock position, and then press into the breast and pull the thumbs outwards, and repeat at 12 and 6 position. And this is done to roll the nipple out. Nipple stimulation can be also done. You can roll your nipple in your hands or place something cold on it for a few minutes to get it to stand out. Nurse as soon as possible after birth, and if every 2 to 3 hours after that, especially initially the babies will need every 1 to 1.5 hours to 2 hours feeding. And this is to avoid the engorgement, and the breast engorgement can push the flat nipples out. Make sure that the baby is latching on correctly. Some feel that football hold or cross cradle fold gives them the most control, which also makes it easier for baby to latch on well. Try calming your baby before breastfeeding and use different calming techniques, which I will explain in another video. Nipple shields should only be used with guidance of a lactation counseling, because there is a chance of contamination and infection if it is used without proper sterilization. A nipple shield should be used only after sterilization before each use. This is a inverted nipple syringing technique, where you cut the syringe at the area around the nostril, then remove the plunger and insert the plunger from the nostril side or the nostril side, and then place the smoother side on the areola nipple and gently pull the plunger out so that the nipple elongates slightly. And this is a double syringe technique. Here also you can use a syringe for applying negative pressure and elongating the flattened or retracted nipple. These are the two deep latch techniques. Initially, when the baby is born, the baby's neck control is weak. So it is better to hold the baby's neck while feeding so that the head does not slip off during the cradle position. So you can hold the baby either using the same side hand or using the opposite side hand. If you are using holding the baby in your axilla and holding the neck, not the head, you have to support the neck of the baby with the same side of the same side hand. It is called the football hold. And in football hold also, you should support the baby with a feeding pillow or a usual pillow, and you should support the mother's back, lower back, with a pillow. Or you can hold the baby's neck using the opposite hand. That is called the cross cradle position. In cross cradle position also, you should support the baby body with a feeding pillow or a regular pillow, and you should support the mother's back with a pillow at the lower side. And this is a nipple corrector which can be used to pull the nipple, but as I already said, these are structural problems and it cannot be remedied. And these things you should always do sterilization before each use. And also when you clean you should avoid cleaning the nipple, in fact, before feeding. As long as you are feeding, you should just take a bath once in 24 hours and change your clothes once in 24 hours and avoid wearing undergarments if possible, because in tropical climates, the skin gets damaged if it continues to remain wet. This is the breast pump, and on the left side, as you can see, which can be used to express the milk, and on the right side, you have the nipple shield. So always sterilize the breast pump and nipple shield by So washing the articles with soap and then with warm water, and then keeping the articles submerged in boiled water for 15 minutes before each use. Then nipple formers, and these are also called breast shells or milk cups or breast cups, and these shells are used to help the nipple protrude, and they can be worn a few months before the baby is born and also every time before breastfeeding session. But I would suggest you should avoid any form of intermediaries because these can be a source of infection. Similarly, nipplet, which sucks out the nipple and stretches the duct and then makes the breastfeeding possible. And I would suggest that these articles should also be avoided. However, breast pump is a very useful device which can be used to express the milk and give it to the baby. In summary, at the end of the session, you are able to identify a flat or inverted nipple, and you are able to advise the corrective measures and offer advice on breastfeeding positions and latching in nipple issues, and provide continuous support to mother. And no matter what your nipple shape or type or breast size or shape is, breastfeeding is a journey for every mom, and she can do it successfully. Thank you for your patient listening.